Hey guys, if you're not able to watch my long form content of podcast, here are some short form clips for you to enjoy. All of us want to look younger.
Yeah,
Even us men today want to look younger.
why not?
What is the difference between Botox and filler?
My God, I thought this question has been understood, but I see people asking even now this question. Most people haven't understood it. So,
Even
simple
I don't know
thing.
the difference, huh, doc?
Yeah,
Yeah.
so it's simple. So,
I know
basically,
Botox is some enzyme or some poison you put in and the muscles freeze
yeah,
up from the wasp. Probably. No, this is my mundane,
yeah,
uninitiated Gawar
yeah,
thinking
yeah,
right now. Okay, so what is a
yeah,
Botox
yeah.
and filler?
So, Botox basically, just put simply,
Hmm.
Botox is a powder that we turn it into liquid from a
Hmm.
little bottle, pull it out and inject into you.
Hmm.
Filler is more like a transparent jelly, which we pull it out and inject into you.
Hmm.
Simple. Now, what does Botox do? It, let's say, for a simple man's term, it eases your expression lines, which means to say, if I have a line when I frown,
Hmm.
I use a Botox. If I have these lines when I raise my brow up, I use a Botox.
Hmm.
You smile and I have crow's feet, I use a Botox. While if I have a line here which is sitting there, etched, right? It is not because I'm moving, it is sitting there. So that I will fill in with a filler. So, filler is an inert substance like a clay,
Hmm.
which I'm putting in and it is sitting there. If I want a cheekbone, I'm putting in, it is sitting there. If I want to give a cheekbone, then I end up putting a little bit there.
Hmm.
If I want to put in a chin, lip, I'm putting in a filler. Basically, anywhere where I want to mold is where I use a
Filler.
filler. Now,
Okay.
how do they act? Filler, like I said, is simply inert, goes in and sits where I put. Therefore, I always say filler is a job of an artist. You master the science, you get your anatomy right, you know your product right. How then you put these two together to create a beautiful
Sculptor.
face? Yeah. So, create a beautiful face is in the hand of the artist, not the tool. You may have picked the right tool.
Hmm.
Then what you do with the tool is why you need to go really do your research when you do the aesthetic treatment, because the outcome is not mathematics, can't be taught. It
Okay.
can't be taught from a teacher to a pupil at all. It's not painting by the numbers can be taught. So those are the basics, but it's not the same template that you can put on everybody's face. No, you don't want to create masks. So you are creating, bringing out the best, correcting those little flaws, enhancing the best features in the person that you're treating. So, therefore, that's a huge art. While a Botox can be equated to, let's say, painting by the numbers, because if I decide what is the bulk of my muscle, what is the extent of my muscle, if I know where is the interdigitation with another muscle, then I can calculate and say this many units, these points, and I'm done.
Hmm.
So, if you know the anatomy really, really well, and you're able to mark it on the surface really, really well, then Botox is a simple thing. How does Botox act? When I inject that into it, so the muscle sends a signal, and when it says I'm angry, you frown.
Hmm.
Correct? So the muscle said you're angry, the muscle does not end up telling anything. There's a nerve that's conducting. Now, nerve comes and releases acetylcholine.
Hmm.
Acetylcholine has a receptor in the muscle. That is what muscle responds to and contracts. So that's why you frown. Now, if I negate the acetylcholine from responding, the receptor from responding to the acetylcholine, it won't respond. I can keep saying I'm angry, but this will say I'm happy, I'm calm. So that is why Botox is also looked upon as an antidepressant. Do
Oh
you know
wow.
that?
Yeah, yeah, it makes
Yeah,
logical sense.
there's a scientific paper which says yes, because you look into the mirror every morning and you're not frowning, you're looking happy. So mine says, I'm happy, and it's like a feedback. So that is why Botox is an antidepressant. So basically, it nullifies the signaling liquid from the nerve to the muscle. So therefore, the muscle action doesn't happen and the frown line doesn't form. That is basic difference. But there's a lot more we can do with Botox, wherein we can narrow, slim the face down, slim the nostril down, pick the tip of the nose up. All these is very experienced injection techniques. So there's so much more can be done. But this is a basic difference. So while a Botox wears off in 3 months,
Oh, Botox actually wears off.
yeah, yeah, yeah.
Oh, I thought it was a permanent procedure.
Not at all. Not at all.
Okay.
How would I then have my patients keep coming back to me? So every 3 months you need to do the retouch up. But while a filler goes in and stays textbook wise 6 months to a year, but we have now seen in our own experiences that it stays for a long time. So that one is a boon and a bane. If it stays for a long time and it's a great job on the face, you enjoy it for a long time. If it's a bad job, then you're also living with it for a long time.
So are there any risks to these fillers or
Oh yeah.
Botox?
Oh yeah.
And
Tech-
I think the risk would come in from going to the wrong person
Yeah.
also.
So if you go to a completely unqualified, untrained person, major things can go wrong. Imagine you're actually doing things blind. It's not like a surgeon you're opening up and doing, right? So I don't have a vision of, oh, this is the artery, this is the nerve, let me avoid this, let me do this, and let me cut here, and let me cut here. I'm doing it on a face with the envelope intact. So I'm going through it. So I need to know my anatomy like the back of my hand. I need to do multiple cadaver dissections, which I keep even now indulging in to make sure my anatomy is refreshed. And as we are growing older, there are so many more newer papers coming up in anatomy where more dissections are done in the face with a different lens now, right? Because they're viewing, the anatomist also are viewing the face not just with a simple lens, but saying, oh my God, these are the newer procedures that the doctors are doing. So let me look at it more closely, look at it more differently. So we now know every plane, what's happening, any deviation in arteries, what are the percentage of people with the same artery going in the same place. So you need to know your anatomy and the tissue reaction very well. If not, you could actually go blind. You could actually have a tissue death. You could have an entire nose literally falling off. So we've had cases such as this around the world, not much in India, or at least it doesn't come out much. But there's a lot of very scary things that can happen with filler. Whatever happens with Botox usually recovers because, like I said, it wears off. Whatever happens with fillers also mostly recovers because the face is such a wonderful organ. There's so much blood supply. So it kind of recovers. But blindness is irreparable.
I'm just seeing you sitting in your clinic, and if somebody walks in, you're probably able to, within about 30 seconds, say whether this person has had some treatment or not to their face.
Yeah, instantly. I mean, they'll sit and say, "Oh, I've done nothing to my face," and I will know exactly. Then I'll put my pen on paper and say, "This, you've done your filler." They're like, "No, but that was 5 years ago." I said, "But you've done, right? When I ask you history, you should have told me that." So I can just see exactly.
So there are a lot of myths about skincare. There are a lot of certified influencers that are there now
Yeah.
today on Instagram, which come and
Yeah.
troll you and me, and they think they know it everything. They just have a camera and then they have a mic and then they're talking about as if they know
Yeah.
the world, but
Yeah,
they
it's
don't have a
scary.
clinical practice.
Scary.
What are some of the common myths that are out there, or hocus pocus stuff that makes your blood boil when you hear about it? Hey guys, if you've enjoyed this clip, then click here and watch the full episode. And don't forget to subscribe because your body is the most expensive real estate and I'm your real estate agent.